This is my patient. She's in supine. So her arms should be tucked on the arm boards, which are underneath here. We have a pillow underneath her knees for a 5 to 10 degree angle, and we placed her heels on a pillow. So we also will apply safety straps 2 inches above the knee, so about right here. So by elevating the heels, we will reduce the risk for pressure injury and DVT. The patient over here is in prone, so she will have 2 chest supports. So underneath here that protects her genitalia and her abdomen. We have a pad underneath our patient's knees. We elevated our patient's heels off the OR bed, and we have her head in a neutral position, and we would have a face positioner underneath her. So we want to assess and monitor position of patient's face, prevent direct pressure on patient's eyes, and assess patient's airway. And then for this position, it's important to keep them in this position for the shortest amount of time possible because of the increased risk for ocular injury. All right, so now my patient's in the beach chair position. So we want to keep her head in a neutral position without excessive flexion, extension, or rotation because this could lead to venous or lymphatic congestion. We also want to pad her buttocks, which would be underneath, a pad would be underneath her. We want to flex her knees at 30 degrees. And we want to prevent her abdomen from resting on her thighs if possible. We want to check for safety restraints and use sequential compression devices. With this one, so with this position, you could have venous air embolism, hemodynamic instability, quadriplegia, compressive peripheral neuropathy, venous pooling, and we want to minimize degree of head evaluation as much as possible because this could lead to hypotension, bradycardia, and that's all. All right, now our patient is in the lateral position, so we want to use a head position or pillow. We want to assess and monitor the dependent ear, support one of the patient's arm on 2 level of the parallel arm board. So one should be facing up and one should be facing down. We want to place an auxiliary roll underneath the patient's dependent thorax, which would be in here, at the level of the 7th to 9th rib. So we want to use the device designed as auxiliary support wide enough to spread its lifting ability over several ribs. So with this one, we want to verify that the bilateral radial pulses after placement are present, maintain spinal alignment, and we should not allow the patient's breast or abdomen to be compressive or hang over edge of the OR bed. And that's all. All right, so now our patient is in the lithotomy position. We want to use a minimum of 2 people to place our patient's legs into the mock stirrups we have here. We want to make sure they're gel stirrups so surgical burns are not possible. We should also use a minimum of 2 people to remove the patient's legs, and we should remove them one at a time. We want to position the patient's buttocks even with the lower break of the OR bed. So with this one, we are worried. We want to keep them in the position for the shortest amount of time possible because it increases the risk of neuropathy, neurovascular complications, compartment syndrome. We also do not want to place safety restraint over a patient's chest or abdomen. We do not want patients' legs to rest against the leg holder post. We do not want scrub personnel from leaning over the patient's thighs or leaning against. And we also want to watch fingertips when the bottom of the bed is going up or down. And that's all.